Welcome to my world, another day, another time, another period for knowledge acquisition. Knowledge is power, health is wealth. Today's topic is debunking cholera misconception. We used to have this misconception that if cholera is in a place and people have it, some people you will discover they really come down with the symptoms: stooling, vomiting, bilious, serious dehydration. But people around there that don't have it, they seem to believe that they don't have it. But that is already one of the misconceptions, because to claim you don't have it, how have you confirmed it? By the time your stool is examined, or that person's stool is examined, it could be passing out the vibrio cholera itself, the organism that really causes that cholera dehydration, the cholera diarrhea. So the infection itself graduates from that area. But the good thing is that once it is quickly treated, especially by rehydrating the patient, yes, the patient may be off it. But if it's something that changes and wants to turn to, probably cholera is not chronic, it's acute infection, and probably wants to stay for long, then it means there is a need for culture and a need for antibiotic prescription. So let's go into the slide to watch more about this misconception of cholera. The objective: to create the awareness of the important role played by medical laboratory scientists in debunking the misconception that these symptomatic contacts are free of cholera, and that is responsible for the clustering of cholera infection. To understand this misconception, let's use this case study. Approximately 2 days after returning from Mardi Gras in New Orleans, Mr. B, a 24-year-old student who was the runner-up in the Royal Oyster Eating Contest, abruptly started to vomit. Within hours, he was restricted to the bathroom with voluminous and nearly continuous but painless watery diarrhea. We must understand that oysters and what you could also call crayfish are things that the vibrio cholera really reside in. Later that evening, his roommate brought him to the emergency room, where he was found to be febrile but profoundly dehydrated, with severely altered level of serum electrolytes. Stool had the appearance of rice water without blood or bile. Microscopic examination revealed no white blood cell. That's one of the misconceptions that one could talk about with cholera, because when you look at cholera, you want to think it's an infection, and all infection you want to look out for white blood cells. Misconception number 1. It is assumed that because vibrio cholera is highly infectious, that everybody that contacted it will come down with the symptom of diarrhea and vomiting. But Harris, JP, and his co-worker found that after injection of vibrio cholera, most of the bacteria are killed by gastric acid in the stomach. The hydrochloric acid in the stomach will kill vibrio cholera, because vibrio cholera survive more in alkaline situation. But some of them will survive, and the surviving organism colonize the small intestine and elaborate cholera toxin. It is that toxin, the major virulence factor for pathogenic strain, that activate adenylate cyclase and raise intercellular cyclic AMP. This leads to chloride secretion through the apical chloride channel and secretory diarrhea, which allows for so many water to now be coming out. Not that the vibrio cholera itself is injuring any cells, but it is just a matter of making over secretion. That is just, and that study was also confirmed by Usalo, SJLT, and many other workers. Misconception number 2. It is also assumed that Vibrio cholera affects children and adults equally. That is, no matter whether it is an adult that is in the area or a child. But Kelman FM and his co-workers demonstrated a more potent effect of cholera toxin in inducing diarrhea in enteric cells of human with blood group O than in those of human blood group A, while group AB are at intermediate risk. This is more or less stating that if you are of blood group O, you are easily susceptible to this infection, this cholera problem. So it could be a guide for people who are blood group O's to always be extra careful, probably taking more serious these prevention things. That you wash your hand, you make sure clean water, but everybody, it's not that the others should not do that. But that research only changes the misconception that everybody is equally affected. That's not true. Some blood groups are very highly, very susceptible, while some are a bit resistant. Misconception 3. It is also believed that all infants are equally susceptible to cholera, but Clement J.D. and his co-worker found that being not breastfed places infants at considerable high risk of cholera in endemic settings. This is clearly known even with adults. Those who are well fed, they have probably a stronger high immunity. Yes, people who are sick are already immunocompromised. They are just more like HIV patient that their immunity has suffered a great degree of damage. But when you are well fed, especially with children, babies who were fed well with the mother breast milk, this breast milk contains so many components and defensive materials that prevents future problems. So cholera is one of those experiences, especially in an endemic setup. The parents probably has built a little immunity, though you have vaccines these days that helps build resistance. So it is not impossible that these children are probably partially immune when they are well breastfed. So it also encourages more breastfeeding of children than yes. Now, misconception number 4. Many people abuse antibiotics because they have the misconception that Vibrio cholera, being a bacterium, must be treated with antibiotics. But cholera treatment is simply using oral rehydration solution. This can be bought, obtained from health workers, or even made at home by mixing 1 liter safe water, 6 teaspoons sugar, and half a teaspoon of salt. If someone has cholera, they should be given oral rehydration solution and then taken to a health facility, cholera treatment centered, or oral rehydration points. Yes, the misconception number 5 is that we generally believe that wherever a cholera patient touches, it's a vector, a mechanical vector for transferring this cholera disease. That may not be true from this finding. Cholera can't survive for more than 1 hour on glass, iron, except on things like clothes that contain some wetness that allows it to survive in moist environment, thereby acting as mechanical vector in transferring it to other people. So it is safe to believe that using glass cup and those things, plates that that are dry. In any case, if they are wet, you could still. So the chances of getting cholera is highly reduced if they are dry. Misconception number 6. From the exposition so far, it is clear that many people who don't wash their hands nor maintain good body hygiene personal hygiene may not come down with cholera, but they may be transferring vibrio cholera to susceptible people. So they may be the source of the outbreak of cholera, or the extension of cholera becoming an epidemic. So it is very necessary to confirm carriers, by laboratory diagnosis, in order to streamline or probably eradicate cholera from that vicinity. Misconception number 7. Let's talk about vaccine. Vaccine, it is not only for prevention, but it's also very helpful for eradication of cholera. We might think of vaccine just solely to prevent. That's another misconception. It might help in the eradication of cholera if the oral cholera vaccine is administered with improvement in quality of water and hygiene, personal hygiene and sanitation, termed WASH, W-A-S-H, then cholera will be eradicated in that environment. So let's move on to the final submission. Yes, before conclusion, there is a need for us to encourage this production by subscribing because you like it and you want more quality production. It's a way of encouragement. So you subscribe or you press the like button. Make comments if you feel it's necessary to help others too through your comment. So in conclusion, finally, the role of the medical laboratory scientist is very important for effective eradication of cholera, because those who are free of the symptoms or even convalescing patients could encourage the clustering of the disease in their vicinity, ready for the next cholera outbreak. There is also the need to control antimicrobial resistance, which is alarming these days. Majority of the antibiotic used like tetracycline are not effective against cholera anymore. So by doing antimicrobial susceptibility testing before prescription, you are reducing antimicrobial resistance by prescribing the exact drug to heal. And also to know your blood group or genotype. They are very handy. You need them to perform all this confirmatory analysis. Please watch more of my video on this channel. You'll find it on Ask Akinola-Anjou on YouTube channel.